What's going on, everyone? It's Alex here from Aleks Physio. Today we're going to be talking about acute knee injuries and whether or not you need x-rays. I'm making this video is that it may save you a 10 or 15 hour wait time for an x-ray that you don't necessarily need. But remember, this isn't medical advice because you want to be looked at by a physio or a general practitioner. To determine whether or not an x-ray is warranted, many physios and physicians use a criteria called the Ottawa knee rules. Studies show that they are highly sensitive at identifying patients who have knee fractures. And why is this important? It can reduce the number of unnecessary x-rays ordered. It can create a more efficient patient care volume flow. It can save a lot of money. It can prevent unnecessary radiation on patients, and it can allocate resources more efficiently and more effectively. So what are these criteria? There are 5 different criteria. The first one is you must be 55 years of age or older. There needs to be tenderness at the fibular head, which is located on the outside of the knee. There needs to be isolated tenderness of the patella, which is your kneecap right in the middle. And another criteria is you're not able to bend your knee more than 90 degrees. And the last one is you're unable to take 4 steps both immediately after the injury and in the emergency department. So 2 steps on each leg. Limping is okay. We're looking at whether or not you can put any weight at all. And if you can't put any weight, even a fraction, then we need to get x-rays ordered to rule out a knee fracture. So why am I sharing this information? And why is the default approach of just doing x-rays for everybody not okay? Well, it's not okay for 2 reasons. The first is that the majority of acute knee injuries are soft tissue injuries, such as meniscal tears or ligamentous injuries, such as ACL, LCL, or MCL tears, which may be diagnosed more effectively clinically or would need an MRI because it wouldn't be identifiable on x-ray. The second reason is that a normal looking x-ray after an acute injury does not exclude a fracture because there's lots of swelling in that area, and sometimes it may be more difficult to see whether or not there is a fracture because of that reason if you immediately do an x-ray right after the injury or a few hours after. For example, there are some fractures like a tibial plateau fracture which occurs at the top of the shin bone. It's easily missed with a knee x-ray if it's not combined with other clinical findings and assessments. So we need to be mindful that just because an x-ray is negative, if it's done immediately after, doesn't mean that we can exclude a fracture. And also, a lot of these injuries are soft tissue injuries, which an x-ray wouldn't even be able to pick up. So there you have it. We went over the 5 different criteria for the Ottawa knee rules to determine whether or not you need to get an x-ray and whether or not there may be a possible knee fracture. Have you had a knee injury, or do you have a knee injury currently? How has your experience been like with our healthcare system? And if you found value in this video, consider checking out some of my other videos where I talk about physio, exercise, and medical related content. And if you still find value, consider maybe subscribing to my channel. It really allows my channel to grow and allows me to reach a wider audience. Until then, we'll see you in the next video. Thanks for watching.